Hi, Leah. Well, welcome to the podcast, our very first podcast. I'm super excited to have you on. Those who don't know you, would you like to run through a little intro?
Yeah, sure. So I'm Leah. I am a professional figure athlete, and it has been a long journey to get there, even though sometimes it looks like she came out of nowhere overnight and had all this success. And then you learn the backstory and you go, oh, I'll leave that to her. I'm a coach, a peak performance coach, and a posing coach for bodybuilders. And I'm also a hypnotherapist. So I have a PhD in mindset. So I'm really intrigued by why some people lean into discomfort and pain and break through the other side of it, and why others shy away from that. And I think that probably, plays a lot into my own journey as well.
So it's such a unique position because you're the athlete and you're the person with the knowledge and the experience in the coaching side of things. And then you get to kind of combine your experience as the athlete and then your experience as the coach and the mindset coach in that regards to help your clients, obviously, as well. Can you tell me and the audience maybe a bit more about what it means to be a figure athlete and bodybuilding, just a bit of background on the sport and what it kind of looks like from a training perspective and things like that?
I always think that to be a bodybuilder, you kind of need to geek out on self-imposed suffering. So obviously, when you're in season, there's a huge restriction on diet component of it. So hunger is part of the game. But when it comes to building muscle as a bodybuilder, progressive overload, hypertrophy training in the gym, some athletes have more cardio than others. Some athletes have more movement than others. But we basically lift heavy things and track our macros and then take off all our clothes to pose on stage wearing small bikinis.
Yes. Great description of
Strange
it.
sport.
And how long have you been in the sport for?
So my first competitive season was in April, May of 22, and my second season was the end of 2023, and my next one will be the end of next year. I wanted to bodybuild for the first time. I think I was 23 when I learned about the sport, and I first stepped on stage when I was 37. So
Okay.
that was kind of the length of time it took to make a reality.
Yeah, absolutely. And then coaching wise, how long have you been coaching for?
In various capacities since my 20s. So in the fitness space, I was also a dance instructor. I've also coached in music. And as soon as I could embrace bodybuilding, I've been coaching in the bodybuilding space since day dot, really. And as a posing coach, ex-dancer into fitness, understand how the body works, understand stage presence and performance from music. So it kind of just combines all the things that I've done into like a perfect package where I love it.
And so there's so many parallels in different ways, isn't there? Like you got your, I think about this often that there's this parallel in whatever the skill set is. Gym training, for example, there's these kind of progressions and this process people have to go to get better. And that is almost the same parallel as what it might be like when you were doing like the piano stuff or you pick any skill. It's kind of the same process and progress that people have to kind of go through there. So it's always interesting when you can just take different fields and combine them. And I think the best coaches are people who've got a background in something else and that they've taken that knowledge set into, say, the rehab world or into the training and performance world. So Leah, we've been working together for a little while. I think we started working together must be 4 or 5 years ago, something like that. Why don't you tell people a bit about some of the issues you've had from a pain and injury perspective and just take us down that path for a little bit?
Yeah, so I met you probably, I wish I'd met you like 20 years earlier, to be honest. So I've had a bit of a complex history with my body and also with my relationship to pain, I would say. So if I can just go back to when things first kind of presented themselves. When I was 18, I had this like 40, 50-minute train ride to uni, and I was sitting on the train going, oh, I slept a bit funny. You know, when sometimes you get a crick neck and you're like, oh, I slept a bit funny, work itself out. By the time I got off the train, I'd lost movement in my arm and I had all these tests done. No one could figure out what was wrong with me. And I was told, as an 18-year-old who had been in the gym for a couple of years, who was a pianist, musician at uni, and I was told you might never move your arm again. And I just remember going, yeah, well, that's not going to happen. It was kind of a blessing in disguise because I didn't want to perform at uni. So it got me out of the bit I didn't want to do.
For sure.
As
The
an
upside,
18-year-old, exactly.
the
That's
upside
kind
of
of
pain sometimes. Yeah.
exactly. But I went through 6 months of intense physio and managed to get a movement in my arm back. And it kind of seemed like that chapter was over. And then I started dancing when I was 21. And every time I danced, I'd lose movement in my arm. And I'd try to go to the gym and it would be fine. And I'd come home, stir a cup of coffee and lose movement in my arm. It was this very, no one could figure out how my pain made sense or why I was losing movement. And I had a surgery done when I was 21 that didn't fix it. So I had the surgery, 6 months recovery, as you do, putting everything into physio. All my symptoms came back. And every time I tried to dance, I was very active. Like I wanted to rock climb. I wanted to be in the gym. I wanted to be a bodybuilder, a dancer. And everything I did, I kind of just ended up losing movement in my arm. And one physio couldn't help me. So they sent me to another physio who sent me to a surgeon who said, it's nerves, it's not your shoulder, go back to physio. And it ended up being 8 years of being passed around different people to try and solve my body. And finally, a surgeon said, this is your shoulder. I'm like, no, it's not. It's not. I've had 8 years of people telling me it's not my shoulder. And he said, it is. I don't need to see a scan. Like, obviously, I had one, but he goes, I don't need to see it. Let me operate. And the first thing he said was, I'm not happy, which isn't a good thing to hear after a surgery. And he showed me a video of inside my shoulder. And it was like he was just pulling out fairy floss. It was just like my joint had disintegrated. And he said the staples were there from my first surgery, but nothing was attached to it. And I had the wrong surgery. So then it took another surgery and excruciating rehab to fix it. And now I've got a metal rod in there. I came to you because of hip issues, because I've had hip surgery and I had hip issues in the past as well. But I think one thing through all of that was really challenging to hear from people was your body's fascinating. And like I understand when like as a professional you probably have cases where you're like, oh, this is interesting, let me at this problem.
Yes.
But people kind of forget that problem's attached to a human being who's been told, just stop doing everything that hurts you. Why do you have to dance? Why do you have to be fit? Why do you have to? I mean, I was a piano teacher who couldn't play piano, being told, give up everything that hurts you. And so when people were getting excited by the fact that no one else could help me, that was hard, you know?
Absolutely.
Anyway, that's a start of,
No,
yeah.
absolutely. And what about from the psychological perspective? You had 8 years or so with this kind of unknown, not really a clear diagnosis. You're being passed from practitioner to practitioner, possibly getting conflicting advice and conflicting opinions. And then also being told that, yeah, you got an interesting body is it's not always a nice thing to hear. From a clinician point of view, absolutely, we see cases that's quite interesting and it's exciting for us, but it isn't a nice thing to verbalize to the patient and make them feel like they're an anomaly. But tell me a bit more about where you're at kind of mentally through that time, if there was frustration or if it was you're able to just accept it and just go with it. Where were you at in that regards?
I have to preface this with I was in my 20s because I think I was a bit silly, I think. Well, but I would do the same thing again. But I'm saying it's because it was in my 20s,
Sure, sure.
even if I would do the same thing again. Um, Chronic pain itself sucks. Like it's so hard to handle from a mood perspective, from a stress perspective, from you're just always hurting. So the way you handle life is different, I think, than when you're pain free. But when no one could help me, when I got to the point of going, if I do nothing, I still hurt. Like I can't hug my brother. Like my dad told me off once for not hugging my brother properly, and I'm like, I can't pick my arm up, and that was his. Oh, this isn't about Leah's six pack anymore. This is something else. But when I did nothing and I was hurting, I thought, well, why aren't I in the gym if I'm going to hurt anyway? So I just kept showing up and pushing through. This is what I'm saying. I'm not advocating for this, people. This is not. But I did because I'm like, if I'm doing physio, I'm doing everything they're telling me and nothing's working, I'm still hurting, and my mental health is tanking because I'm not dancing. I'm trying to do this thing. I can't do this thing. Like I was so lost because I didn't have an expert. You didn't exist in my life yet. You know what I mean? Like there wasn't someone who could, number one, go, I understand how you feel. I think you're probably one of the first people, apart from the surgeon who had the answers. literally the from a surgical or a like that kind of medical profession, he was the only person like that to me. And then, yeah, I've had rehab people who kind of care if I can do exercise or not. But I think you're the first person who asked me how I felt, which is, I think it shows the progress of the industry as a whole, maybe as well.
I
But
hope so, yeah.
in my days, I was just like, well, I'm just going to keep hurting myself because otherwise my mental health tanks along with my physical health. Like I started in the gym when I was 16, and as a young female, I mean anybody when you're young, body image matters and you get a bit stupid about how you look as many young women do. And when I first had to stop because literally I couldn't do anything, my self-worth was so attached in my muscles. That was a really challenging identity to deal with. Like I identify as a fit person and I can't be fit. Who am I? Like that was really hard. And then I kind of then just went, well, I'm going to do it anyway. And then I finally, between my second and third surgery and before I came to see you, I was terrified of the gym. Like I'd gone, been that stupid, I'm going to do everything, smash myself. And then I finally got to the point of going, I don't want to break again. And then I was so scared of actually moving, like, because I knew what would hurt me, or I'd learned so many patterns of pain. You know, I remember seeing you perform an exercise and I was hurting just by watching you because of how strong a pain response I had. So then it was like, I got over my identity being my six pack, even though I'm now a bodybuilder. My self-worth is not attached to my six pack. I think there's a difference. But yeah, I took on the identity of an injured person. I'm an injured person who wants to be a bodybuilder, but I'm injured. And that was, I think, you helped me so much with reframing that identity, which was so important because otherwise I wouldn't be the bodybuilder I am now.
Yeah, the identity component, I think, is something that many clinicians, but I also think many people with chronic pain struggle a lot with. We definitely see it with athletes, but you also see it with mums, say, struggling with pain and they can't be the mother they'd like to be. There's lots of just different examples where our identity is tied to an action, a behavior, something. And then when we have pain and we can't do that thing, we have to start to recalibrate mentally that as well. But I think when you take that on really well, like you did, um, it's a good deep dive internally to find yourself, so to speak. You know, kind of find, who's Leah if you can't train, because there is a person there, believe it or not. It's
I do have to say, I think a lot of people who are drawn to fitness to the point of obsession, like, where it is part of who we are and it does take up a lot of our time or life, let's say. I do think that often there's something in life that we are not quite dealing with. And I would say I couldn't run anymore. I had to deal with something like home life things, some, traumas that had happened in life and those sorts of things. Like I couldn't just go and pick up heavy things to forget about that. I actually had to sit in the funk of it, which I think was actually very painful and hard and extremely necessary to get over the other side of everything being connected to whether or not I can go to the gym.
yeah, that's such a big point, isn't it? It often does take away something you might be masking, and it forces you to just deal with that thing. And often dealing with that thing is a big part of the recovery in itself anyway. So while it's difficult for some who have to go through that, it also is part of that recovery journey as well. Okay, so we had the 8 years of pain. We had kind of dealing with the identity side of things. Who's Leah without the training? Tell me what that recovery looked like and felt like in terms of, did you feel like you were making good grounds and progress early on, or did it feel like you were kind of working on things, but very slowly, gradually getting progress? Tell me about that.
I think so early on, and when I say early on, I don't even know when I'm talking about now because I've rehabbed and regressed so many times since, over the time. But I think every time you feel like, let's just say when you're at the bottom, you literally, you can't do anything. You got to kind of build up again. Showing up in the gym was hard because my ego was there. I think all of our egos are there. Like I honestly want a shirt that says I can lift heavier, it's deload week. Like everyone goes, oh no, it's deload. to judge what dumbbells I pick up. Literally, I'm still like that, and all my clients are like that. And I literally had to use my body weight to, I remember learning to chest press again, and I was literally lying on the bench, not even being able to do full range of movement, going, well, I can't even pick up a dumbbell. People are going to go, what is she doing in the gym? So there was that little mental hurdle. But I think the frustration around, I want to be able to do a pull up again. I can't even do this. There has to be an acceptance piece. Otherwise, you're just going to hate. Number one, you'll hate yourself. Number two, you'll hate the activity and you'll go, what's the point? I'm giving up. It's too hard. And I think that's one thing I've never done for whatever reason. When everyone was going, just give up, just stop doing things, I just couldn't accept that. And I think my lack of acceptance of not being able to do what I want made me go, well, if this is where I have to start, this is where I have to start. And so, yeah, it was literally just begin right again, and even worse than a beginner, because you don't even have a functioning body yet. And then through rehab, of course, it's like 2 steps forward, 4 steps back, 1 step forward, 6 steps back, 10 steps forward. It's not a linear process. Even though we want it to be quick, we want it to be there, we have to. I think I learned a lot of respect for my body and a lot of respect for what I'm capable. I mean, I still go through it, right? Like, it's still little setbacks here and there, the frustration, but the frustration is either short-lived, or mostly I can separate it from what has to be done. Does that make sense?
Yeah, 100%. I think in the rehab space, the challenge we often find people have is there's a delay to your effort. You want the pain relief now and you want to see progress now, but often there's a delay. You kind of have to build a bit of a base and keep going with it, even if you're not getting kind of those direct results, because it might only occur like 3 or 4 weeks down the track, might even be a little bit longer. And so it can be a little bit challenging mentally to say, what am I really doing this for? I'm rocking up, I'm doing my rehab, I'm doing what I've been told to do. I've been doing it consistently for 2 weeks and I don't feel I've made any progress. But sometimes it's the 4th week that things start to tip and starts to change. But it's that delay and how well you can mentally continue going while there's no instant changes happening.
And sometimes you don't even recognize, like, I could carry a cup of water. You might not even notice that as a win because it's such a normal thing to be able to do, right?
Yes,
You're going,
absolutely.
I want to do a pull up, and you don't even notice that you rolled out, you could lie on that side in bed or something like that. There's all these insignificant, in quotes, wins that have to happen that you may not even recognize.
Yeah, yeah. I mean, we talk. I've probably spoken to you about it, I can't recall, but the 1%ers, you got to look for them. The little 1% wins. The little wins are the most important thing because they're subtle. And if you don't look for them, you don't find them. And if you do find them, you bloody well celebrate them, because those 1%ers turn to 2%ers, turn to 5 and 10 and so on. They become more tangible. And so it's the little things, but you have to be aware of this. I think this kind of is where kind of the mindfulness side of things comes in a little bit, which I'd like to hear your perspective on, which is as a kind of someone who's really attuned to the mindfulness side of things, where does that fit into your recovery and mindset and all of those kind of things? Where does the mindfulness component come in?
I mean, eventually, I think it just becomes habit and who you are and how your mind works. But I suppose there's a lot of training it that way. But I am a massive advocate of setting intentions, because if we wait, this may seem like a bit of a tangent, but it'll connect. Like, if we wait until we're in the mood for something, then our mood will dictate what we do, and motivation is fleeting. Oh, I feel like this, I'm going to do this. I don't feel like it can wait. That doesn't get you anywhere. So rehab, you can't have that approach to rehab, right? Because you never feel like rehab. Who feels like seeing how crap they are at something? Which is, to me, that's the definition of rehab.
Sure.
Sorry, Dan, truth.
No, that's understandable.
So you kind of have to have the intention of, this is what I'm going to do, regardless of how I feel. And I think that goes for anything in life, right? Like, set the intention. I always do it the night before, because then you've already made the decision and you just do what you've said you're going to do. That intention, I think, helps with showing up to rehab and actually following through with rehab. I
Can I
also
ask a little bit more just on that intention? Are you talking like each day you're waking with intention to do something, or each training session, or you're thinking just on the longer time horizon there?
I like to be really specific, and it connects to, I mean, this is such a famous approach now, thanks to James Clear and his Atomic Habits, but like habit stacking, right? Like, what do
Mm.
you already do that you can attach this to? So, if you have stretches or things that you can do while you're watching TV, if you watch TV at a certain time, well, guess what? That's when you're doing your rehab. Like it's those types of things. But the intention would be, before I actually get into my training session at the gym, I'm going to do this rehab then. So it's very specific. You're kind of making a commitment and a choice, not waiting to see how you feel about it.
Yeah, it's becoming, yeah, you're creating that proper habit by being intentional about when and where and how you're going to do what you need to
Exactly.
do.
And then I think presence is such a huge thing, which is what
Yeah.
mindfulness is, right? It's being,
Yes.
but if you're doing a rehab exercise and you're frustrated that you're not able to do something else, that's not helpful because all you're doing is making yourself feel bad about where you are. It's not going to change where you are. It's just going to make you feel crap along the way. So if you can, and I mean, I think this is where my music training, dance training comes in. Get really curious about how it feels and how you're moving. Because as soon as you can be curious, you can't be judgmental and curious at the same time.
Love that.
Right.
Yeah.
And so that's gotten me through a lot, especially when rehab can feel boring. It can feel like just a hassle. It can
Mm.
feel useless if you don't see the progress, like you were saying before. It's not fun. Nobody does rehab for fun, but you do it because it's necessary. Whereas I think as soon as you're intentional about it, and I'm looking at my foot because obviously, like I broke my foot, so I'm looking at my foot. That's what I've been rehabbing. When you're intentional about what you're doing, it becomes fun. Like, well, I think so. Like you get curious
Yeah.
about it, and then you've got your little progress. You notice the 1% more. It kind of becomes fun. For me, what is I have to separate rehab from gym.
Mhm.
Otherwise, I get frustrated because I'm wanting to grow my muscles, whereas rehab is not a hypertrophy exercise. So I've had to separate those two things so I can stay intentional and present.
Yeah, I love that. I love the being, yeah, present and having that intention as well. It's such, again, I think a lot of people just go in and they're like, it's just another thing you got to do. So you just quickly knock out your exercises. You're not very aware or mindful in the moment. And that plays a role in the results of those exercises as well. Because I
How
think
can
ultimately every time you rock up and you train, it's that little 1%. If you just get 1% better from each rehab session you do, whether it's some stretches or some activation work or strength work, whatever it might be, if every session gave you 1% improvement, and that 1% was because you were being very intentional in that rehab session, it doesn't take that long to start to see some changes then. Take 10 sessions to get a 10% improvement. But the intention is a big one, huge one.
And I do think it filters into the rest of your life. So let's say, for example, you're really good at being intentional in your sport or in your work, even. You've already got that, bring it into your rehab.
Mm.
Or let's say you're going, okay, I'm going to use my rehab to practice being more present and more intentional. Actually changes how you operate in the world. It makes the world so much less stressful.
Yeah. Yeah,
Mm.
absolutely. That's great. All right. So then coming forward from there, so we've spoken about a few challenges along the way. Tell me about like, were there any particular turning points in let's talk about more of the shoulder side of things. Any particular turning points that you started to see some real progress and felt like you were making some good gains there?
I think it definitely wasn't until the second surgery.
Yep.
And after seeing inside it, I know that, whether a scan shows you need surgery or not, I often think if I'd known you back then, would I have even needed surgery? Like, that first surgery was clearly the wrong one. Could I have avoided surgery altogether? You can't play those games, but who knows? But after the third surgery, through that rehab, it felt different to the other times that I'd rehabbed my shoulder. And I think stability had a big thing because I couldn't fall out of anything because there's a metal rod there. So that definitely helped. And I remember, from when I was 21, I was thinking about this the other day. I had the same New Year's resolution for 15, 16 years. And it was, I'm not going to get injured this year. And I failed every single year until 2021. So yeah, it was about 16 years or so that I had that I'm not going to injure myself this year. And I failed until 2021. 2021 was a few years, probably 5 years after my third surgery. And that was the year I went, enough is enough. I need to get back into health and fitness because I don't think I have any reason why I can't, except that I'm scared now. Because every time I've done it, I've had surgery, I've had rehab, people haven't understood me, I've been told all these things about my body. And as soon as I made that choice, I got my coach for the first time because I knew I was too scared to have a program myself. And then I started my program, and what happened? Niggle shut up. My hip was the first thing that went awry. I was told by this coach, you need a very specific sport chiro. You can't go to any chiro. You can't go to any physio. You need a sport chiro. I'm like, what the hell is that? And that's how I found you, Dan.
Yeah, so good. There's not many of us around.
So I'm very grateful.
Yeah.
I'm grateful to that coach. She was actually based in the US and she had a sport chiro. So, but yeah, very grateful that she had the insight that someone would be able to help me who wasn't just a PT trying to tell me how to do an exercise in the gym. And when I met you, I mean, I swear there was probably lots of tears at the start as well, because you try to give me rehab. And like I said, all it would do is make me go, I'm going to hurt. I can't do this. And still, if we do a new exercise, half the time I can't do it the first time it hurts. And then 30 seconds later, there's no problem. And it's just my brain going, danger, danger. Yeah, and then the biggest turning point was our conversations around relationship with pain. How does pain work? How do we not identify? Like, I'm not injured. That's a huge turning point. Just being someone looking at you and saying, I understand, and you're not injured. My body might have been completely dysfunctional and not operating well, but it didn't mean I was injured. That was a huge turning point.
Your belief or people's beliefs around pain is super important because it dictates their attitude and their behaviors around their injured side as well. And one of the biggest things, and I know we've spent lots of time on this, is that fear of using the injured site and then the identity we give to that site. So people often will say, oh, it's my bad shoulder. And I think that's an insight into their mindset, that they identify it as just a dodgy body part, which is completely 100% understandable. But over time, we want to try shift that feeling of this is my bad shoulder or my bad knee or whatever it might be to just to not that. It could be this is now my strong knee or my strong shoulder. But even those little words give you a bit of an insight into where people's mind is at on their injury. And something we observe a lot of the time when we work with people is they might start care with us and say, oh, I've got a bung knee or something like that. Or, this is my bad knee. And we we kind of drip feed that bit of education around just trying to not identify things as their bad side or anything like that. But over time, they just stop saying it. It's just an interesting observation. They just stop identifying that particular body part as, some crappy part of their body, and they start to maybe be a little bit more positive about it. And I think that's a big, big part because a huge thing for people, something called kinesiophobia, which I know we've spoken about, which is just the fear of movement, which is a very common thing when you've had persistent pain. But the point of rehab is to show people it is safe to use that area. Even if we're starting at a very regressed level, we progress over time and slowly teach the person, both consciously and subconsciously, about the fact that their body is adaptable, that we can start to use those tissues again. And it's just a gradual process of progressively challenging the shoulder more and more, or the injured site more and more, until they feel very confident. And I think often the peak happens when they then transfer that rehab into their, say, training in your regards, where it's kind of working rehab. Okay, now we're kind of in that training realm. Like we're kind of doing the stuff we'd regularly do. And that's where I think there's a big kind of tipping point mentally for many people, where they kind of go, oh yeah, I'm good. I'm back to where I need to be.
I will say one thing that popped to mind then was, and this is why I'm a bodybuilder and not other sport, I think, even though bodybuilding was always on my mind. Bodybuilding is very forgiving. You just need to grow muscle. It doesn't care what exercises you use. It doesn't really care how you do those exercises, as long as you're targeting the tissue and there's enough resistance over time to adapt. So I know my shoulder doesn't work like the other shoulder. It's not injured. I still think, well, yeah, it's a bit dysfunctional, but it's just found another way to work. There's part of that is I sometimes I do get frustrated, and because I can't I can't for some reason do some things because it loads up my neck differently, or it does these things that just the exercise, the progressive overload is not on the muscle anymore. It's how much tension can I handle in other parts of my body. So we just adapt how I do the exercise. So some previous injuries where you're no longer injured, there's ways to do something, even if you have to adapt still. And it's totally okay that you have to have adapted. So that, yeah, that's one thing that comes to mind.
Yeah, no, I think you're absolutely spot on. I think bodybuilding and rehab actually are very close. They have big parallels there. So I think a lot of bodybuilders can get their head around what that process looks like pretty easily. And I often think you mentioned a term like progressive overload, which is gradually building up more and more resistance or more and more reps, maybe whatever it is, gradually challenging the body more and more. On the rehab side, we still have that, but it's just slightly different in the sense that often it's just graduated exposure to a thing, where it's just slowly starting at a different side of that spectrum and building to a certain point. But when you just look at it through that lens, it's all kind of on one spectrum in a way. It's just starting down low when you start at the rehab, where you're just building your base and getting just simple range of motion, for example. And then at a certain point, yeah, you're going to graduate into being able to then progressively overload and train in the way that we typically do in the gym. But I like what you said before as well about how your shoulder still gives you some grief and has its challenges, but it's just adapted around that, which I think is what the body does the best. It learns different ways to still do the same tasks, even when there's a history of tears or surgery or whatever it might be. It learns its own way. It kind of adapts around it a bit. And the analogy I sometimes use in the clinic is kind of like if you think about a river and you put a big stone in that river, the water's just going to still find its way where it needs to go. It's just going to kind of flow around or flow in whichever direction it needs to get to carry on down that river. And yeah, rehab and injury is very much the same.
I do want to say that reminds me when you mentioned tears and things. Earlier I said I wonder if I could have avoided that surgery. Before I had my second surgery and he was examining me, he goes, "Whoa, your left shoulder is more loose than your right shoulder." He
Yeah,
was
there you
like,
go.
I
Yeah,
could I could operate on that side. I'm
yeah,
like, I don't have any symptoms that side. He's like, okay, well, let's do your right. Come back to me for your left. I didn't
yeah.
have any symptoms. I know like it's super loose, but it doesn't have any symptoms. So I just think sometimes it's interesting. And I think hopefully that's what's kind of changing in the space as well. The idea of what is inside your body and the type of intervention you might need is not always surgical.
No, absolutely. It can very well be. Sometimes it's needed, but a lot of the time, I think we can work around it and get to a point where we just don't need it. So tell our listeners kind of where you're at now. You've been through a lot over really, over 10 years now. Tell us what training looks like for you, what your goals going forward are, the more exciting stuff to come.
Yeah. So I broke my foot last year. My foot has recovered to the point where I am training pretty much back to capacity as I would want to as a bodybuilder. So I have a 5-day split uh, program in the gym, resistance training for hypertrophy. I Other than that, I like have steps, but I don't have any cardio. It's not necessary. I'm building at the moment, and which basically means I get food while I train. And when I'm in season prepping for comp, where I'll be dieting down to show off the muscle that I've built, that will be next year, leading into October, November. Training wise, I still get nervous when I have something new in my program. And I often come and see you and say, my coach has put this in, can we do it together? Because like I just need to know that I'm safe to do it first. I don't know that, I mean, that might change. I might actually kind of start trusting in my body more, but from where I was,
Mm.
I've developed a lot more trust in my body. I was thinking about this earlier. So when I broke my foot and it gave me a massive setback, you always kind of question your identity. Does this mean I'm not a bodybuilder? Does maybe I wasn't very good anyway? Maybe, you know what I mean? Like your brain goes into this, like, trying to figure out what things mean. And I think sometimes I don't think this happened to me, but I could see how it could happen to me. You can kind of use your injuries as an excuse or your fears around pain and restriction as an excuse. And I say this from a place of love, understanding how easily it could happen. I'm a competitive bodybuilder and I've had quite a lot of success in the sport. Leading into my next season, I'm gunning for more success in the sport. And it's one of those things where it's, high kind of stakes, high competition, you're really pushing hard. I could have easily gone, oh, I can't train as well as I could. Maybe I'm just not like it's kind of a self-sabotaging excuse. You have an excuse for why you're not going to do very well. You know what I mean? And I was thinking
Yeah,
about it. I
absolutely.
was
Yeah.
thinking, that's not me. Like I'm gunning. But there was a moment where I was fragile because I was recovering from injury, where I could have gone down that route, but I didn't because it's not how my mind works. But you could almost see why people would do that if you're a competitive athlete and all of a sudden you've got a reason that you can lean on as to why you didn't as well do as well as you wanted to. I could see that that could be quite compelling.
Did you
Like
have
that's me, but I just caught the thought for a second and went, oh, I don't like that, no. But it's just interesting.
Do you feel like, because this is a conversation I have quite often with people as well, not just people who perform, but just everyday kind of people. Do you feel like you have people around you in your world, friends, family, coaches, that are generally a little bit more positive and optimistic around this stuff, or do you not have that?
Yeah, no, really good question. I do. So what we had to do was just adjust my season. I was meant to compete this year. We had to put it back a year because of how much time I lost. And so that was an adjustment we made because of my goals. And my coach is extremely supportive, is always reminding me of the one percenters, is always adapting the program, going on the journey with me, very, very supportive. My parents are extremely supportive. I have friends in the sport. I still have friends outside of the sport who go, are you still doing the stupid bodybuilding thing? Like, whatever. But yeah, no, there's people in my life who go, yeah, this is what Leah's doing, and we support her in that. Yeah.
I ask that because what we see quite often in the clinic is that bit of kind of social life that you have, friends, family, coaches, work colleagues,
And you
whatever,
have you too.
is and myself, of course. But that's an important thing because if you've got friends or family, for example, this is what we often hear, who don't have that attitude
Yeah.
to say their loved one, or the person sitting in the room here, that they kind of are more on the side of, hey, you need to protect that, you need to avoid, you've got to stop doing that stuff. If you've got your parents telling you that, or friends, or work colleagues, or even your coaches and things like that, that I think can push that person's behavior just down to, I'm just going to give up. It's not for me. But those kind of messages that you get around you, even messages from clinicians and doctors and things like that, are so important because if they're not congruent with what you believe and there's enough of them, you will naturally start to believe what people closest to you are telling you, even if it might be incorrect.
Yeah.
But that's what I think often for many people. I had a guy just the other day who he was a big runner, loved running, got some knee pain, years of pain and arthroscopes and everything like that, and stopped running purely because it was like the doctor said you need to stop running. His concerned wife and I think it was his parents were like just saying, just you need to pull back. This isn't good for you. So he had very influential people in your world, in his world, telling him to stop. And so he did. We kind of are getting him back on track in that regards. But you can absolutely understand how important those messages around you and how much I think people should sometimes need to find other people where they can, other coaches, for example, if they're not giving the right message, or even other clinicians and doctors. That's a big one that I advocate for, is find people who will teach you how to do the thing you want to do, not tell you to stop it altogether.
I think one thing is, and I know that your audience are more your patients than medical experts, but you never know. They could also be one and the same. I think that people in places of authority, like positions of authority, like if you've got an injury, any medical professional is in a place of authority that has to be acknowledged. They don't have crystal balls And the one thing that like I am so passionate about, which is why I became the coach I am and all of like the things I've focused on, no one knows your potential. And no one has a right to limit your potential. Like, honestly, I would be a couch potato or in a mental health institute, and I say that with love, if I couldn't be who I am because I believed the people who said I couldn't be that. You know what I mean? Like the time's going to pass anyway. Why not find out what's possible in that time, regardless of how regressive you have to start and how many bumps, speed bumps, hurdles, that you have to go through. You might as well just stay curious, keep showing up, figure out, if you get a dead end, try another way, who can help you. Like we get to choose what we believe, but I don't know that that's always easy when someone in a place of authority says you can't.
100%. Yeah, I think going back to something you said earlier, I think it is slowly changing in the medical and kind of, let's call that allied health world. A bit more proactive healthcare, not trying to predict. I mean, the amount of people that we have who are like who have been told by a surgeon that they'll never do something again, and they're like doing better than they were even before surgery. I couldn't count them at this point. It just happens all the time for people who are able to stay in the game and continue working towards their goals. But I think it is slowly changing over time, gradually, slowly. So hopefully over the next 5, 10, 20 years, athletes who have pain and injury are getting more positive messaging and working with more proactive, optimistic clinicians for their treatment and rehab and things along those lines. Leah, so to finish up, I'd love for you to maybe give me a few of your lessons. Somebody maybe listening to this who's dealing with some degree of chronic pain, who's struggled a lot along the way with various clinicians or have had surgeries, and maybe there's a little bit of surgical regret or something along those lines. What would you say to that person?
Number one, it's okay that it sucks. Don't fight it sucking because that just makes it harder. So it's okay. Like feel the feels that you have to feel in that situation, right? And don't stop looking for answers. And there's not just one way. Yeah. So if you try a way because you think that is how this thing is done, but it's not working for you, just stay open-minded. And I think it comes back to curiosity. Stay curious to see what other pathways can open for you. Patience sucks. Like you can't tell someone just be patient because what does that even mean, right? That means to me, I don't know, the definition of patience means don't take action yet. And I definitely don't agree with that. So I would say do what you can where you are while trying to do more. Yeah. So you're on the journey of there's a different possibility out there, but do what you can with what you have now. Yeah.
Yeah, I definitely resonate with the patience bit. I think a lot of people get annoyed to hear be patient because it does sound a bit like just stop and wait and see, which isn't the right approach a lot of the time. We need to be proactive and work within the confines of our ability at the moment, but being patient with those longer term results.
And it kind of sounds a little cliche and also a little bit sucky to say, but you're going to come out the other side stronger because of what you went through. Like I wouldn't be the coach I was if I hadn't gone through. I wouldn't be the athlete I am now if I hadn't, there's so much growth in the adversities that we face. And I kind of half roll my eyes even as I say that, but it's true. It doesn't, like I said, it doesn't make it easier, but accepting, staying curious and doing what you can within the confines while you aim to grow that. Yeah.
Yeah, that's a big one as well. We say that all the time to people, is that the point of good recovery is not that you end up where you started, but rather you end up beyond that your strength and confidence and the things you've learned along the way lead you to being either a better athlete or just somebody who's just understands their body better. Yeah. And if it's taken with the right mindset and the right approach, like you've done all the way through, on the outside of that is actually a much bigger success. Mm. Perfectly. Well, thanks so much for your time. Really awesome to get your insights. I've said this to you a whole lot of times, but just that people like yourself who've got that great mindset just are always inspiring to see how well you progress, obviously in whatever you do, but definitely watching you through the rehab journey has been really inspiring. And it I think often just comes from that place of just knowing who you are, a place of learning and just having an open mind and going with the experience and taking from it what you can. And so I hope your message to somebody who listens, if anybody listens, this is our first podcast, so who knows? To somebody hopefully who listens is just to take away those kind of points of being mindful, being present, and making sure that you still live in that journey and keep leaning into your goals.
Yeah.
Thanks, Leah.
Thanks, Dan.